Joshua Smith here with my good friend and business partner, Jim Brown. We're here with the Forj Life podcast. And today, guys, we are going to break down a topic that is, something that it seems to be growing in popularity, something that's been, when I say popular, necessary for a long time. But it seems to be something that's growing. When I say growing in popularity, just growing in awareness. More people, I think, are gaining more awareness of this. And I know that this is one of Jim's specialties and something he gets blown up on all the time. Something I also get asked about quite a bit. And not because I'm the expert in this space. I look to Jim and my optimal health, physician doctors that I work with, to pick their brain on their expertise with this. But as a TRT client, somebody that's been on TRT for about 5 years now, I get asked about it a lot as well. So, with that being said, we're going to jump on in. If you guys have any questions regarding this, just type in those questions, or even if it's a question you have health, fitness related, whatever that isn't on this topic, toss those in and we're live here. We can see your questions. We'll do our best to hit on you guys' questions and so forth. So, Jim, let's just jump on in, dude. And let's start with, I guess the most basic for those that aren't familiar with TRT, like at a high level, man, what is TRT?
Yep. So again, my disclaimer: we're going to be painting with some pretty broad paintbrushes today. I'm going to be speaking in more macro and vague terms. So if you're, an expert or know this field really well, just have some patience with me. So testosterone replacement therapy is the replacement of your hormone, specifically testosterone, to get you back into physiological range where you normally would be. There's a variety of reasons why you might have low testosterone. It could be something physical, like you had a testicle crushed or removed or whatever, and it's non-functioning, or it could be brought on by what we think is probably due to environmental factors. It could be lifestyle. It could be a few of the things that you kind of bring on yourself, where the environment has brought you to the point where you're not producing enough testosterone. If you find yourself in that position, we've laid this out pretty exhaustively in the past. But typical symptoms, you're probably, unless you've had a mechanical failure like testicle damage, you're probably in your late 30s, 40s, 50s. You notice a lack of energy. You can't recover from your workouts. Your sex drive is completely gone. Might even be, it's like a gradual slipping away of a person that you were, years ago, almost like the frog in the pot boiling type thing. You realize it at some point. You're like, wow, I'm really different now. Your mental state is different. That would be some of the physical or physiological reasons to get checked. Obviously, then you would have blood work done, ordered by a physician, and together with the symptomology, a diagnosis could be made that maybe you're a good candidate for testosterone replacement therapy. And then you begin your journey of, optimizing your hormonal level to kind of bring yourself back to where you once were and where you should be. For a variety of reasons, quality of life and health being probably the most important.
Yeah, I know for me, dude, it was I was 33 years old when I first started on TRT, and that's about the time I met you, and through a mutual friend of ours. And dude, I mean, I was doing everything right, and when I say everything right, meaning I was eating clean, I was working out hard, I was like what we see to be the right things, right? Maybe general public, the average person at that time, what I perceived to be the right things. And again, working out consistently, man, I was eating clean and taking in a lot of water, getting adequate sleep and so forth. But dude, I just didn't like no matter what I did, I felt just a lack of energy. I'm like, this isn't right, man. I mean, I'm, with as hard as I was working out, and again, with as clean as I was eating, and just taking it even to the extremes at that time to try to regain that energy, I'm like, something's off. And, that's at the time that I met you through a mutual friend of ours, and that conversation came up of, have you checked your testosterone? And, for me, it was like, I always looked at, first off, it was that mindset of testosterone replacement therapy being steroids, and thinking like I had just a negative perception in my mind of that, right? So I had some resistance there. And then also like, like I wasn't from a sexual performance aspect. It wasn't like I wasn't not performing there, so, but again, it was just that energy standpoint. And when I finally gave into it and got over my ego on it, dude, like I think my levels were like 311, it was just, and I don't know what all led to that. Probably a lot of years of just being an entrepreneur, crazy, insane hours, crazy stress, environmental stuff, as you mentioned. But dude, it makes such a big difference. And, I look at it with, it's like women, a lot of women, hit an age, especially like during menopause and so forth, where they go through a lot of, not all of them, but a lot of them will go through a hormone replacement therapy, routine in a route. It's just not as something that's, widely as I guess discussed or just maybe the norm with men that is women. But the reality is, man, shit changes, So with that, and correct me if I'm wrong here, but, with this, it's not about, like my thought process of thinking of TRT is steroids like an athlete would take in that manner. It's more of just getting your body balanced to where it's supposed to be balanced, right?
Right. I mean, that's a definition, or even in today's crazy, scripting practices and stuff. Yeah. If you're replacing your body's natural testosterone, it's going to be in a physiological range somewhere, according to a lab result, it's going to be somewhere between, let's say 250, 200 to 1100-ish, something like that. And more importantly, the cessation of symptomology is associated with low testosterone. And so those two things together would define kind of the range of where you would want to physiologically be for optimal performance and health. Above that isn't testosterone replacement therapy. That's taking testosterone and then some of the other things that they prescribe with it now and are getting away with. That's not replacing your natural hormones. That's a performance add-on, which is fine too. Obviously, with my background, I don't have any moral high ground on that, but that's different than what testosterone replacement therapy should be, hormone replacement. And one is for performance and increasing, I'd say increasing for physical performance or body composition. The other is really just to be healthy. I mean, you can take testosterone replacement therapy and get your testosterone where it should be normally, physiologically, not work out or do anything. And I mean, it's not like you're going to put on muscle. Now, if you take a cycle and you take a performance enhancing drug regime, even if you don't work out, you'll see some body composition changes, most likely, because it's a higher than physiological amount of hormone in your body, and it does have an effect. Some of the people, one of the big things on Twitter is you'll have somebody say, I'm 50 years old, I'm not on TRT or whatever. It's a shirt, picture of a guy lifting or something. Well, that's great, but that good for you. That's not really to be. I don't think there's anything to be proud of over that. Versus a guy who actually clinically qualifies and uses an appropriate testosterone dose to replace, where they should be at anyway, without having compromised hormonal system. And so, I mean, we could get into the, performance aspects of that. There are a few advantages of taking synthetic testosterone versus your own natural production. For instance, if you're dieting for a contest or if you're, training for a competition where your testosterone would probably be compromised during that prep for that event. If you're on synthetic testosterone, you could, I think you could have an advantage. So I'm not debating that, but there shouldn't be any shame in saying that you're on testosterone replacement therapy or at least checking for it, in my opinion. I mean, it's the same as being on high blood pressure medicine or, something appropriate like that. When you've tried, you've tried everything that you can lifestyle wise or modification wise to see if you can affect your levels naturally. And when that fails, then, I absolutely think testosterone administration is appropriate.
Yeah, and dude, when I get asked about it, like I tell people, because there is a common question I get is, like, dude, am I gonna? How's it gonna differentiate like what I do in the gym and so forth? And I'm like, look, man, you're not gonna get necessarily jacked. It's not. I compare it to the almost the feeling I had like in my early 20s. Right, just from an energy standpoint and so forth. It's it took about 2 weeks, 2 to 3 weeks, for me to start feeling that impact. But after about 2 to 3 weeks, dude, it was, instantaneous, man, of that energy I was looking for, man, the reduced brain fog, the mental clarity, the just overall energy that I was used to having, and like I said, it was just that kind of, I guess that's my best analogy to give is it was how I felt mentally and physically in my early 20s.
Well, even the cognitive decline and cognitive change is pretty astounding. There were 2 times in my life where I just wasn't taking enough. My body wasn't producing testosterone, and I wasn't taking any. And that was one when I, decided to end my bodybuilding career, and I went from a very high level of androgen use to trying to clean out to see if my body would restart. After being on for, I don't know, 15 years, and it didn't. So I spent 6 months, trying to suffer through. Went another 2 months, so 8 months total of having, very low testosterone and my body not producing any. And that, so I had a little stint there of what it's like to be in that position. Mentally probably was one of the biggest changes that I noticed immediately. And then of course, energy and recovery was hampered, and, libido was crashed. The other time, which I do want to touch on, is when I was taking a DHT inhibitor. When my hair was starting to fall out, I tried to take finasteride or dutasteride to kind of curb that and see what I could do to slow that process down. And I found myself, taking a large dose of DHT, and got to the point where, I was starting to get depressed, and I couldn't think. I really felt like I was a different person, almost like I had a brain transplant. And that was a little scary. That took some time to clean out, but that was just that, over time started slipping away very slowly. And then all of a sudden woke up one day and I'm like, there's something wrong with my head. I'm severely compromised cognitively, and so that cleared up. But that's how it is, man. It's you find yourself in this position, and that's very typical. You're like, I don't recognize who I am. When you start therapy, it's almost a night and day. How many times have you seen it? I've seen it a million times where, a guy 2 weeks afterwards be like, wow, I feel more like myself. Your brain starts to work again. Your body starts to work better. And really, health markers should improve in your overall health, and, everything should improve in your life.
Yeah. Yeah. And this goes without saying, but YouTube's getting pretty strict with the disclaimers that you put out there of, look, all of this is with TRT. It's all done through your physician. Your physician's going to guide you through this. Your doctor's going to guide you through this. And whether it's your regular physician, or if you choose to, like Jim and I work with an optimal health physician clinic that specializes in this type of work. They're going to guide you through it, and everything that we're saying here is just our 2 cents on it. We're not doctors. Listen to your doctor at the end of the day, right, of what all of this looks like. Is there ever a reason of why a man wouldn't want to go down this path, even if their testosterone levels are maybe low? Maybe it's one of these things where they're planning on having kids, but they haven't had kids yet because there can be a risk, potentially there. Is there ever a reason as to why somebody shouldn't explore this path?
Sure, there's all kinds of reasons. We've definitely heard ethical considerations where people just don't want to do it. They think that it's cheating, or ethically they don't believe in it. If you're competing in an organization that forbids it, almost every sports organization now feels that that's a severe advantage. So they disqualify those athletes for it. Health-wise, I don't think I could think of one. I'm sure there's somebody out there that has one, but maybe just being uneducated. In my opinion, it's hard to say, but I think probably ethical is the largest one I see. You don't see a lot of people that are competing at a high level that don't take it because of that.
Yeah, what's crazy too, dude, is I've had a lot of friends over the years that have went this path, and it's like, man, I don't. And usually it's people that I know that are into their 30s or 30 or older. But I've seen one out of everybody I've talked to, dude, one that their test their levels weren't extreme. When I say extremely low, you know, with mine at 311 when I first got tested, you know, I was talking to my doctor at the time, and he's like, dude, I mean, this is the levels of what a 80-year-old male should have. And I don't know if this is true or not, but I heard at one point that the average 18-year-old male today has a testosterone level of the average 55-year-old during like the World War II era. And again, just it could be food, it could be a lot of different things that come into place there, you know, but it definitely seems to be something is impacting this in a negative front. And again, you know, this is about getting your body back to where your level should be based on where your age is at and based on where you're at. It's about getting you, you know, kind of back to homeostasis, if you will, on how you should be operating, you know, with where you're at. You know, but dude, it's and I know you led into this in the beginning, but I mean, is it, you know, do you think it's due to just the crazy amounts of stress that people have? Do you think it is due to more of a lifestyle, or is it more due to diet, or like I know this is kind of theory, you know, but of your best guesses of, you know, why do you think that this seems to be such an issue today?
Well, there's a lot of data on it, and there's a couple books that have been written about it, about this specifically, why hormone levels are being compromised. And you know, I don't memorize the data. I can't tell you which study it was, you know, but there have been tests done all across the world with all male populations, and you know, sperm counts going down, hormone levels are going down. And I remember one person, professor, whoever was conducting the study over years and years and years, you know, they were asked for his conclusion, and he said, literally, it feels like they're spraying something on the air over the whole world, and everybody's being compromised. So, yeah, I don't know if it's, you know, attributed to one thing, you know, phthalates in the air, toxic. There's a lot of those things that can contribute, and have shown, you know, statistically and through data that they do compromise. Is it a combination of everything? It's a combination of our new lifestyle with the stress and the nonstop, you know, I'm sure, less mineral and quality food, everything. I think everything. You know, the real answer is we don't need to know exactly what it is, but we need to know how to combat it. And, you know, this is probably the best way to do it, is to replace the therapy. There's a few people that can do lifestyle changes, you know, reduce stress, start to exercise, lose some body fat, and forego having therapy for a while. Maybe, you know, I don't know how long they can postpone it, but you can certainly change that around. And if you are going to be a candidate for replacement therapy, it's going to be further down the road. But, but you know, that being said too, what are we going to do? Am I going to change jobs and get a less stressful job so my testosterone hopefully comes back up? I'm not doing that. You know, and it's a lot to be considered. I missed on having children. Yeah, I don't know that there's any solid protocol that would guarantee if you go on testosterone replacement therapy that you're going to be fertile. You know, we've always thought that the best way to ensure that is, if you have motile sperm, you have quality sperm now, is to freeze it and then go on therapy if if that's a real consideration of yours. That being said, you know, I know myself and a lot of people like me got my wife pregnant on a very large, obscene dose of testosterone. So it's not 100% for everybody, but again, if you're concerned about that, the best way to do it is have samples frozen.
Yeah. And for me, I mean, I was already done having kids. I already had a vasectomy when I started this pass, so I knew it was going to be safe for me. And I don't know if I would have risked it, you know, prior to that. Because I mean, the reality is anytime when you introduce something synthetic and your body no longer, you know, it needs to produce it on its own, like it's going to shut down that production, you know, right? So, and there's ways, again, that your doctors can prescribe different things that kind of combat that and can help with that, and different protocols to take. But we do have, before I get into the next question, we do have a question here from somebody that's watching live. It doesn't say your name, so I apologize about that. It just says Facebook user. First says, been on TRT for 2 years now, life changer. Yeah, glad to hear it, man. Next one is, as a general statement, what would the level of a man at 45 be at or should be at?
Depends. You know, that's a two-step verification or a two-step process. One, do you have symptoms present? And if you do, then that would kind of justify some lab work, and then you would compare that lab work with the symptomology to see if your number is indeed, compromising your quality of life and health. I know that's not the answer you want to hear. You want to hear a number, but I've seen and talked to people that had very low, in my opinion, total testosterone at 200s, but didn't seem to exhibit any symptomology. So is that a candidate for replacement therapy? Not in my opinion. It was okay in the range. I mean, at the very low range, but he didn't have any symptoms. Then you have guys, like myself that would be, because I've been on testosterone a very long time, that might have something to do with it, the body size, for whatever reason. If I'm at, a total testosterone of 800, 900, as a rule, I start to get symptomology. And so, I keep mine a little bit higher to be symptom free. If I was symptom free at 700, that would be fine with me. So I wouldn't get tied into a specific lab number. Remember, anytime that you're verifying or you're having lab work done, blood work done, that's just a tool to help the diagnosis process, the process of being diagnosed for a condition. It's not, an end all be all, like, a high PSA doesn't mean you have prostate cancer, or, it's just part of the tools in diagnosing what's going on. So, that being said, most people are exhibiting symptoms, somewhere in the 200 to 400 range. But that's again painting with a very broad brush.
Yeah. It's and what I've found, and this is just my experience on this. Like maybe I'm wrong on it, but it seems like when you're working with a good doctor, they're not just going off of the labs, but they're also going off of how you feel. And having those conversations on how you feel energy wise, how how are you feeling with it? And it's that combination of, making sure that you're in alignment with where your blood work needs to be, along with, how are you feeling, with that? And it's really putting those couple pieces together. I mean, would you say that's an accurate statement, Jim?
Absolutely. I mean, we both know there's testosterone mills out there that, aren't going to give you a real chance at being diagnosed. They're just going to do a lab, and if it's somewhere within range, they're going to prescribe it for you. And that's okay. I mean, that's legal, and that's your choice. But I think that with a higher end physician, he's going to take all those things, or he or she is going to take all those things in consideration and see if you can adjust anything lifestyle first, or maybe give you a chance to correct it before prescribing, and seeing if you actually have verifiable and real symptoms. You're not just looking for a prescription. There's some considerations with this. When you start testosterone replacement therapy, it's never going to be or feel like your natural production in a range where you're free of symptoms. It's never going to feel that way. And it's a lifetime thing. Yeah. Am I going to be taking at least 2 shots a week for the rest of my life? Yes. And, I'm okay with that, but, it's a commitment for sure. It's something to be taken serious. I wouldn't start it unless you actually clinically needed it.
Yeah. So then if somebody's going to go down this path, and let's just say they start working with their doctor, they get, they find that they're low, they start on the TRT path. What are some things that are important for people to do to get the full benefit of this? Like as an example, I recently, went on this journey to really level up, I guess, my health game, dude, like get my body fat lower and, and so forth. I was guilty of that kind of COVID-20 that so many others were guilty of, dude. I lost some muscle mass, put on, about 20 pounds of fat. And one day I'm doing a podcast, a video, and I'm watching it back. I'm like, holy shit, what happened? It was subtle. I didn't realize how out of whack I'd gotten, but I got out of whack, dude. And, but through that, man, I, as my body fat started getting lower, dude, it got to the point where I was on the same dosage, 200 milligrams a week of testosterone cypionate for, the 5 years straight. And then all of a sudden, dude, my test levels, even though that hadn't changed, shot through the roof as my body fat got lower and my workouts got more intense. Now I've adjusted that to 180 milligrams, per week. And dude, still, I'm just every bit as good, if not better results. But it seems to be that maybe there's and I don't know if it's the lower body fat or
No, you're right. Yeah.
in training, velocity or so forth. But, what are things for people to ensure that they really maximize as they're going down this journey to ensure they maximize the benefits of it that they can be doing?
Well, I mean, there's a lot of people who aren't going to change anything, right? They're just going to go on and continue doing what they're doing. But if you want to optimize your health or start to take this seriously, a lower body fat percentage, I can tell you as a fact, the leaner you are, the better the drugs work in your body, whether it's almost any drug, especially testosterone and anabolics. If you're leaner, it works better in your body. And, that may be in part because, fat cells and body fat in general is going to probably mean you're having a higher estrogen level. Who knows? I'm not sure what the exact reason is, but when you're leaner, it works better. When you're leaner, I think you're healthier, to a point. I'm not talking, single digit body fat, but, in between for men, 8 to 14, 15, probably ideal. For women, probably up to 22%, something like that, where you're lean, you have visible abs. That's what I consider probably the optimal health kind of composition. Of course, with some muscle mass, you don't have to be huge, but you have to have some. I think, and we've seen this a lot of times, especially with the clients, it's a time for people to start taking their health serious when they go on TRT and they want to learn about diet, nutrition, and start applying that. And they want to take their workouts a little bit more serious or begin to work out. And I think it's a good time to start that or take that stuff serious if you haven't. When you start to reach the age, mid 30s, 40s, early 40s, maybe where, your testosterone's starting to decline, that's the time in your life where you really do have to start at least taking your health serious if you're going to have a high quality of life going into the latter years of your age and your life.
Yeah. Yeah, and what's cool about when you go down this path is legally you have to get blood work done so frequently. Yeah. And I look at getting blood work done is like a P&L statement in your business. It's like, dude, like you gotta strip things down, and it's the ultimate gauge of knowing how things are really going with your health. It's that that true indicator, and you can make adjustments outside of just the TRT dosages and what you're doing there, based on what that blood work looks like. And, there's a lot of benefits to it, and it gets you in that habit. It forces you the hand on the habit. If I wasn't on this, I don't know if I'd go consistently get blood work done at the same rate that, I'm forced to, being on the protocol. It makes a huge difference.
Yeah. Yeah, I agree. I've been taking blood work on myself since I was 20s, early 20s. And, it's a good way to kind of track what you're doing, what your health is like, and, see if you have any red flags pop up that probably would be left undiagnosed for years on end until you're further down in disease pathology that could have been identified and corrected probably without any medication or interventions.
Yep. Awesome. Yeah, Pierre says, love you, Josh. Love you too, my man. So then when it comes, like I've had friends that have went down this path, went through their, let's just say their family doctor, their local general practitioner, and, seeing things like they have them come in every other week or once a week, once every other week or whatever for an injection. And, start seeing, so I'm just kind of leading with that as an example of, what are some kind of things that are important for people to know, to again ensure that they have success with this, because there's a half-life when it comes to testosterone, and a shot every 2 weeks is probably arguably maybe doing more harm than it is good.
Yeah, well, let me start by just breaking down the different types of testosterones. We'll start with testosterone, the molecule. Usually you don't see that in a prescribed application. That's been more of an underground product where it's just the testosterone molecule, either stabilized in water or some type of real thin oil. The stuff that's prescribed is usually an esterified testosterone, meaning it has kind of a carbon chain attached to the molecule that has to be broken down in the body before that testosterone molecule will fit into keyways and cells and, kind of dock into wherever the receptor is and do its thing. So typically we see sometimes a testosterone propionate, which is the shortest chain of esters that you'll probably see in a prescribed medication. And then the most common is probably testosterone enanthate or cypionate, and that's a longer chain. Um, no matter if you have a combination of those products or a single version of either of those three, you're going to want to take multiple doses in a week. And I feel, I've done just about everything that you can do in every type of preparation and administration. I feel that 2 times a week is probably the fewest amount of dosages that you can take and have a real good result from your therapy. And we do that because we don't want to have peaks and valleys in our testosterone level over the week. And so if you have a physician that's recommending, like a testosterone enanthate shot once a week or once every 2 weeks, I would definitely do your own research on that and figure out, well, at least kind of build a case to have an intelligent discussion with that physician, or absolutely say no and figure out something else on your own. Usually when a physician has you come into the clinic and administer shots, I believe, in my opinion, that's just a method to generate revenue. It's definitely not the best in terms of what your therapy could be, again, in my opinion. So no matter what you get prescribed, if it's probably going to be a longer chain like enanthate or cypionate, maybe it's mixed with propionate. 2 doses a week is probably the least amount. You can do every day or every other day. The goal being to have these doses so that the half-lives don't go through and you have a huge peak and then a deep valley before you have another peak and another valley. You want to have kind of, if you're dosing multiple times over the week, you're going to have more of a linear, stable, total testosterone and estrogen. You're not going to have these peaks and valleys. And you can feel that in your therapy. You'll feel it throughout the week. And so just from a, again, broad strokes, macro overview, that's probably one of the things to be considered when you're speaking with your physician and starting to go on this therapy.
Yeah. And like, dude, I work with a company called BotMD. I don't know if you still do, Jim, or not, but
I don't anymore.
And I'm not, saying that they're the best or whatever. It's just who I've worked with for a long time now, and they I haven't had any issues with them. But do they? I mean, they ship me everything once a month, comes in the mail. Right, that way I can administer everything on my own. And and this was something that Dr. Meehan, we had on the podcast multiple times in the past, recommended to me. Was because like for me, I've been very sensitive. Like I even as a kid, man, I had a lot of issues with acne. I had to go on acne medication, and so even at the regular TRT lower doses, like I had increased acne, and he had me just increasing the frequency. And for whatever reason, I don't know why that is, whether it's it helps balance the testosterone with estrogen, because when test goes up, estrogen can go up too, or if it helps with, DHT levels or whatnot, but I do 4 times a week. So I just break it. It's the same dosage. I just break it up where I do Monday, Tuesday, then Thursday, Friday, take Wednesday, Saturday, Sunday off. And it's solve that problem.
Yeah, whatever works. We know that if you're really sensitive to estrogen, which most people aren't, but some people are, more frequent administration leads to an overall less estrogen level. And, it does feel better to me as well. It's just a huge pain in the ass sometimes,
Yeah. But, it's part of the morning routine. And
that's right.
It's,
a
lot of people that have this, issue with injections and injecting themselves, dude.
You can get a cream, and there's people who have liked that type of therapy as well. There's people, even though I wouldn't recommend it. In my opinion, it's not the best, at all, but you can get pellets implanted if you want. Typically that leads to a very unstable release of testosterone over the time of the implant. But, there's people who do that because they don't want a shot and they don't want to do the cream, but whatever, if whatever you find that works is really the answer for you. You want to be symptom free and then, perhaps backed up with a lab test to justify that.
Do you, so a lot of times when you use, like if you're working with usually like an optimal clinic, and I don't know if I've never worked with my family doctor on this stuff. But the common protocol seems to be, like your testosterone, whatever, whether it's cypionate or whatever that they're administering there, and then like an aromatase inhibitor of some sort, and then a lot of times it might be like with HCG, injections and so forth. What? So it seems to be, and they might be under different names, but that kind of like three combo that a lot of it seems to be the standard protocol from a lot of these companies. What is the benefit or the positives or negatives of like an aromatase inhibitor and with like an HCG? If there's a benefit or not a benefit and so forth.
Yeah, well, first off, if your physician's going to put you on all three of those medications to begin with, in my opinion, again, I don't believe that that's the best protocol to start anybody on, and a lot of physicians do, and they can argue with that. That's fine. Some of the most progressive and advanced doctors in this space that have been doing this, have a very large practice of people, a high amount of replacement therapy people for 30 years. Don't do that. And, in part, I don't think, well, one, I don't want to start taking 3 new drugs at once to see if it all works together in a secret combination. I want to, if I can, I want to administer 1 drug at a time and monitor to see what happens. And if another drug is needed, or if I feel, I want to feel the first drug, so that when you add the next one, I can kind of evaluate, well, one, do I feel better? Because that's really, a lot of this is quality of life. And 2, is it actually needed? So starting with an aromatase inhibitor, I think is a really bad idea. There's one of the doctors that I probably respect the most has a 6-month kind of memorandum on that, moratorium, whatever, a pause on that before he'll start to prescribe, and he'll prescribe if really needed. If you exhibit some symptomology of high estrogen, but that's a very small subset of patients that are going to start with this therapy. I think it's doctors not being educated properly, and or perhaps from a liability standpoint they feel that that's justified, or maybe it's a revenue stream. I'm not really sure, but some people want to take HCG, and but overall, if you just start on testosterone and see how your body reacts, give yourself 6 to 8 weeks, and then start to evaluate if you need an add-on. HCG does some things. Some people like it, libido-wise. Some people like it because it prevents your testicles from shrinking, which is typical with testosterone replacement therapy. I don't know that I would ever openly want to recommend somebody be on an aromatase inhibitor. But there's some side effects that come with that as well. So I don't know. In my experience, the most advanced qualified physicians in this space don't just throw all 3 drugs at you to start.
Yeah. So, and just to be clear, so an aromatase inhibitor is vastly different than like an HCG, right?
Right. So an aromatase inhibitor is basically going to cut down your estradiol level. It's specifically used. Well, it wasn't originated for males, but when you're giving it to a male, it's to cut down estrogen levels, basically, with broad brush. HCG is used to keep your natural production kind of on with FH and LH, or FSH and LH. Those are 2 hormones that are involved in natural production of testosterone that your testes produce. And when you start taking testosterone replacement therapy, those levels completely crash. There's those who argue that your body still needs those, even though it's not involved in producing, you don't need it to produce testosterone anymore. Also, like I said, some people don't want the shrinkage of testicles, so they want to go on that as well. But again, that's starting to be pretty expensive therapy as well. I think some things have changed where that's a little bit more costly right now. If you don't need it, I don't take it. I'm one of those guys. I want to take, the least amount of drugs that I have to, and the least amount to get, a desired result. And, so I like to have guys evaluate it beforehand. I want to be I'd like to see somebody on a base of testosterone, see how their body reacts, to see if they want to add HCG, and then you can try it and see if you feel a difference. And if not, It's not like you have this special combination you have to take forever because you're afraid, you feel good and you're afraid that, if you drop one, something's going to happen.
Yep, love it. All right, so Chris is asking. So Chris is up in Canada, and he's asking if you know of any companies, like you mentioned, that service Canada.
I'm sorry, Chris, I don't. The only physician I work with now is Dr. Meehan still, and he's only authorized to prescribe in the United States. I think we had tried this before, right, Josh? I don't think we ever found anybody that was in Canada, did we?
Yeah,
I don't recall. Yeah, I don't.
Yeah, and a lot of it, it's because with a lot of this, and I mean, it depends on, but they're working with compounding pharmacies and so forth, and crossing country lines is it can be a difficult process. So, but I would just check with with your local physician, your local doctor, and jump on Google, do some research, and see what options are out there, and just like anything that you're vetting, you'll vet it, right? See the testimonials, vet their experience. Like I always have a little bit of skepticism of working with a doctor that isn't like a TRT patient themselves, if you will, right? That doesn't have experience themselves. Not saying that that's always a foolproof way, but I that's something I look for, right? So if they have personal experience with it, and just see how long that they've been doing it. And because we're seeing a lot of physicians move to this route, at least here in the States, because of, if you look at insurance, it's getting tougher and tougher for doctors to go out there and make a good living, right? So this is a way to supplement their income, because a lot of your optimal health physicians or clinics anyway aren't covered through insurance, right? So it gives them more revenue streams, and so forth. So you want to vet it like anything else, vet their experience, how long have they've been doing this, and so forth, just like anything else. All right, man. So as we close up here, any last words on that we didn't cover that you feel is important for people to know as they go down this path?
Well, there'll be some objections. Some people are concerned with if you're working with like a testosterone mill, they're going to have some things like if you have a PSA reading that pops high one time, they're just going to shut off your therapy. They're going to not be able to prescribe you testosterone and refer you to a urologist, which is normally an exercise in futility, because you're going to go to the urologist and 90% of them are going to say, oh, you're on testosterone, you can't take that anymore, stop, which is absolutely not true. There's plenty of pieces of current data out that suggest having an optimized testosterone level is healthy for your prostate. Also, a lot of these mills won't really dive in and get to the reason why your PSA might be high. So there's a difference between going to a testosterone mill and working with a physician who specializes in this. For most people, they're not going to have a problem. You can work with a discount testosterone subscribing company and not going to have any issues. But the minute that you do, you'll find it to be a little bit of frustration. But other than that, I would just enter this with the mindset that you want to have symptoms, justifiable symptoms, and lab work to kind of justify that. I've tried to correct it through lifestyle, and know that once you start this therapy, you're probably going to be on for the rest of your life. If you go off, it's not like your body's going to be like, wow, thanks for the rest, buddy. We're going to start making it now. Yeah. That just doesn't happen. So once you start, it's a lifelong commitment, but it's a commitment that'll improve the quality of your life and definitely put you in a more optimized space for health, cardiac, vascular, mental, libido, everything. Because when your hormones are compromised and they're below limit, that's just as dangerous as having them, not in optimal range or having them higher than that. So anyway, just keep that in mind. If you guys have any questions, you can always hit me up. Happy to help.
Yeah. And just my ending kind of 2 cents on this is, look, if you're going to go down this path, and this is something that, whether you go down this path or not, it's probably an important path, but it's work with a doctor or find a clinic or physician that, is really versed in overall preventative health. If you look at our medical system, it's all after the fact. It's okay, like you're sick or you've got this going on. How do we, fix this with, some type of a drug that exists? If you look at your your average doctor today, and this is just from my physician friends that have shared this knowledge with me, but it's something like 5 to 8 hours of actual nutrition and training that they get through that whole time. And if we look at Western medicine, it's not preventative based. And this when I think about optimal health and going down on this optimal health, I guess lifestyle, if you will. Dude, it's about, all right, how do we prevent this stuff? How do we be preventive with this? It's like when, all the stuff that we're seeing right now with COVID came out, it's reached out to several physicians that I know, and I'm like, all right, like what do I need to do to be proactive with this? So, if and when I get this, my body's in the best position to handle it and so forth. And how do we just prevent from, age-related diseases and so forth? So, I guess I'm going with this is, working with a physician that can analyze your blood work, show where you're off, not just with testosterone, but with other things. It's like, I don't know. I mean, I don't know how many thousands of blood work panels that you've read over your lifetime now, Jim. But, it's like, they're just things that like, okay, seems like everybody's deficient in vitamin D, right? And there's just not just saying everybody, I'm sure there's some that aren't, but the vast majority are. And so they can work with you with your supplementation routine, with your diet, with other things, to really maximize this preventative health journey, because that's the goal, man, is just to operate as the best versions of ourselves and reduce the risk of these, these age-related diseases that come up later in life. All right, so let's just see here. Looks like we have, I don't know if these are, Pierre says, I'll be on your podcast soon. Remember the name. You got it, my friend. What's the best way? So Pierre does ask, and we'll just maybe end with this last question. See if I can pop it up here. What is the best way to naturally improve testosterone?
You have to sun your balls, man. Just kidding. So that's kind of a loaded question, and I'm going to refer to my favorite answer. Depends. Really depends on what's going on in your life that may be compromising your testosterone levels. Are you sleeping enough? Are you eating properly? Are you obese? Are you drinking alcohol? You're drinking 4 or 5 whiskeys a night. I mean, there's quite a few things that it could be. So that's kind of a loaded question. I'm not really sure. There's not a one-all answer, right? I mean, if you read Twitter, it's just eat steak and get in the sun, but that's not true, man. It's different for everybody, so it's kind of hard to say what I would say the best way to improve it is. But if you think about your body as a finely tuned machine, when that machine is out of tune, it doesn't operate optimally. And so if you have low air pressure, if you need spark plug change, I mean, there's a lot of things that it could be. But if you think of your body as a machine, you want to treat it and tune it up and keep it operating properly. And that's usually being at in my opinion, training, working out, getting enough sleep, eating properly, having a low body fat percentage, having blood pressure that's in check, all those things. So again, depends.
Yep. Love it. All right, guys, for those that joined us, we would truly appreciate you being on here live with us. And we will be back here every single Wednesday, 2:30 p.m. Pacific time, 5:30 p.m. Eastern Standard Time every single Wednesday. So we will see you guys next week. Peace.